what are the tests for Babiosa and Ehrlichia that are different than the test for Lyme?
Well, Babesia is a parasite, and so you can do antibody testing, which shows the history. You can do a PCR, and you can do what's known as a Babesia fish, which is a test that I often find very good to use, which IGeneX does. And then you can also do a Babesia smear. I find a smear is a way that in the past we've diagnosed malaria, and so we also do the same for Babesia. But I often find the yield comes back negative a lot of times when the clinical picture is for Babesia.
I know you mentioned the last case about your daughter, Ehrlichia, and she was tested negative for Lyme, but what test did you do to discover what was wrong with her?
Well, I did a panel of...
The same thing?
What?
The same thing, looking for the antibodies?
Yeah.
And are the panels in the standard practice wide enough, or are they too limited?
Well, a lot of times, initially, primary care physicians will just do an antibody test. So they'll do an ELISA test, and if it's negative, they'll stop there. I see a lot of physicians that don't do co-infection testing. So my initial panel, I will test someone for the antibodies, depending on the case, the PCR, because the PCR is the first thing that's positive, because the antibodies may not be positive for 4 to 8 weeks, but the PCR could be positive after 2 weeks. So it depends on the case and it depends on the timing when you do that.
And I know I have a question too. It seems that there's a lack of uniform diagnostic tools that are available or maybe that are shared. So how can the state help to resolve some of the issues that we're seeing because there aren't uniform guidelines? What would you suggest that we do?
Yeah, I think, educating physicians on the co-infections, on Lyme would help. And also, I feel that New York State physicians are so hampered by not being able to use certain tests when they're available in 49 tests. So I understand when they want to check the efficacy of a test, but I mean, I don't know whether 49 states will have a test that's not going to be good in New York State. So I think that's a problem.
Thank you, Dr. Bock. And Senator Helming has a question as well.
Thank you for your report. It was very good. So the co-infection testing, how do we get that out to physicians? It goes along with Senator Serino's question. How do we let them know that, look, you should go beyond that first test? You should do the co-infection testing.
Well, I think you have to start with educating the physician on the whole concepts of Lyme and co-infection. If you just put out, do this, no, it probably won't work. They have to have an understanding when they're talking to the patient. Like, what I do in my history is on every patient, I have pattern recognition on my history. So if I see patterns that go for Lyme, or I see patterns that go for Babesia, then I'll do the test to confirm it. The lab test